in terms of management, at this stage, we do not have a curative treatment. However, there is a lot of symptomatic management that we can do. We have our child or an adult with a mitochondrial disease in the center, and we have multiple people gathered together, helping together, working as a team to help our families and also the children. So just going back to the clinical features of the mitochondrial condition. So there is, as you see, so many possible problems, but I'll focus on the central nervous system and also the gastrointestinal system. So when we talk about the central nervous system, that's the brain and also the nerves, and the problems that we see in a child with the mitochondrial condition would be global delay, developmental delay, the loss of skills. If they have acquired some skills, they can lose that. There's seizures, flappiness or low muscle tone, like this child here, for example, with a very poor head control. There could be coordination problems, abnormal walking, unsteady walking, and also a movement problem. So what can we do? We can have what we call mitochondrial supplements. In terms of the mitochondrial supplements, in a systemic review, looking at the use of these mitochondrial supplements, there is very limited evidence that these are beneficial. However, in our unit, we still give these mitochondrial supplements, for example, thiamine, riboflavin, and coenzyme Q, because these are usually well tolerated and with minimal side effects, and there's could be a case-to-case benefit of these mitochondrial supplements. And of course, there are medications for the seizures and for the movement, and we usually refer to other specialists like our neurologists who can help us with trying to control the seizures and also have some medications to control the movement problem. So stroke-like episodes, they can happen in children with mitochondrial diseases, and in particular in teenagers and adults with, for example, with MELAS. And what is important is the recognition of signs and symptoms, and the signs and symptoms could include headache, speech problems, slurring of speech, for example, more unsteady in the walking, muscle weakness in one side of the body, visual changes like blurring of vision, and also seizures can also be a manifestation. And we have, aside from supportive measures, we also give medications called citrulline or arginine. So studies, in particular, studies done in MELAS have shown that there is what we call decreased production of nitric oxide. And this decreased production of nitric oxide would cause the decreased cerebral blood flow. And by giving citrulline or arginine, we are able to increase the nitric oxide production, hence improve the circulation into the brain. And the supportive measures would include making sure that we have nutritional support and also rehabilitation. So all of these are in place to help a child or an adult with a stroke-like episode. So like any other child, children with mitochondrial disease can also have common viral illnesses. We have observed that children can become more unwell, more than usual with these episodes of acute viral illnesses, and takes them longer to recover. Having these illnesses adds stress on the body that is already running on a low energy capacity. Hence, it is important to support our children, particularly during this acute illness. And specific decisions, including hospitalizations, would depend on the clinical situation. And we would usually encourage our families to contact the treating team so that they can be assisted as to when to admit the child, or just it can be managed at home. And some of the things that we can do, we treat the infections with antibiotics as needed. We also assess the feeding, the oral intake, just to keep the child hydrated, and also, of course, giving medications to lower the temperature if they're febrile. So surgeries, our children and adults can, with mitochondrial disease, would require surgeries. So it's important for the surgeons to know about the diagnosis. And we would usually encourage to refer prior to this surgery, to refer to the anesthetist for evaluation, so that the anesthesiologist can evaluate what are the problems. Is there heart problem, a muscle problem? So and with the knowledge that the child has, or an adult has, a mitochondrial condition, then they will sort of plan ahead what safe anesthetic agents to use. And then, if possible, we would encourage first in the list of the operating theater list of the surgeons, and admission the night before. And in this case, we avoid prolonged fasting because fasting can be an added stress to the body for the children and adults with a mitochondrial disease. And we also start some glucose-containing fluids intravenously once fasting has started. And we do baseline blood tests to check the sugar, the electrolytes, and also the lactate levels, and all of this to make sure that we will have a pre-operative preparation and operative, also a safe operative procedure. And post-operatively, we continue monitoring, and that could include doing blood tests as well. So the next common signs and symptoms would involve the gastrointestinal tract. Around approximately 15% of Mito patients will have gastrointestinal involvement. And it's because for the gastrointestinal tract to function properly, we need the coordination of our nerves and also the muscles that would be present in the gastrointestinal tract. And the signs and symptoms of the gastrointestinal involvement would include feeding problems, swallowing problems, vomiting or reflux, and also constipation, diarrhea, and there could be delayed in the emptying of the stomach, and there could also be sort of sluggish movement of the intestine, such that there would be what we call a pseudo-obstruction. And because of these gastrointestinal problems, there would be problems in the absorption of nutrients, and then at the same time then leading to poor weight gain. So what can we do for the gastrointestinal signs and symptoms? We can, again, give medications, like, for example, give medications that will block the acid production. And we can also give medications to relieve the constipation. And then also, very important component is the nutritional support. We can modify the food consistency, make it a pureed or a blenderized food, and the frequency of the feeding can be small but frequent feeding. And then if orally we are not able to keep up with the requirements for the fluids and the nutrients, then there is that option of nasogastric feeding. And then if not, then the gastrostomy. And dietitian input is also very important. So this is just to show a nasogastric tube. So we have the short term and the long term, and the short term can last for a few weeks, but we have a long-term one that could last for months. And this is inserted through the nose and down into the stomach. And then we also have gastrostomy tube, so that it would be a surgical procedure done by the surgeons or the gastroenterologist. And Yeah,
Can I
yes.
just give you a time check? We're getting quite a few questions, so I just wanted to see if we can wrap it up
Yeah,
with
yeah.
the questions. Thank you.
Yes, I have two more slides. I think three.
Okay.
And then what can we do? The allied health services would also be important. So we have the physiotherapists who can help us improve the low muscle tone. They can also give us some exercises to prevent stiffening of the joints. And we have the occupational therapists who can help with making sure that there's strategies on how to help our children in transferring, in going to the toilet, and the speech therapies as well, very important because they can help assess the swallowing. Because if you have a swallowing problem and we take the food orally, that can cause aspiration pneumonia. And of course, the role of the NDIS. And part of the management would be also surveillance. Mitochondrial diseases are progressive conditions, so we need to have regular assessment for other systems involvement. And this is why there are so many appointments to see the heart doctor, the kidney doctor, also the endocrinologist who would be managing the hormone problems in our children.